Clinical Monday, the best way to begin a healthy week. Welcome and thank you so much for joining us. My name is Vee Ka Nkosi and courtesy of Dent Exporters out at Mpumalanga in Tanzania. We are back again for yet another clinical topic in an exciting episode. Thank you so much for joining on our Facebook page, on YouTube and anywhere else with the hashtag Clinical Monday. And today also back by popular demand and making their second debut. Hopefully we'll have many seconds. I'm counting seconds many times. I'm joined by our clinical associate, Bianca, Khumalo, to speak to us about renal insufficiency and HIV medication. And also, we are understanding TLD, and they're here to answer all the questions that you and I might have. So please use the comment section below to do so. Continue liking, continue sharing, and continue being part of the family. Bianca, good morning.
Good morning.
How are you?
I'm doing good. How are you?
We're doing great. Festive season approaching. I mean, a lot of things are happening, but we are there. We cannot wait for the year to end so that we can rest. We've been out here. So before we dive in, can you briefly explain what TLD is? Also maybe what does it stand for? Because we use the term, just today. Yes. So please tell us that, and then how is it used for HIV?
Okay, so TLD, right? It's 3 medications in one, basically. TLD stands for tenofovir, lamivudine, and abacavir. So with this combination of drugs, it's mainly used to suppress one's viral load of the virus, and then it improves immunity as well. Right?
Yes.
Because you're reducing the virus.
Yeah.
And then as well, by that, it decreases the chances of you transmitting the virus to someone else. So yeah, that's basically how it works.
Got you. And we often hear about the term renal insufficiency. What does that mean? In simple terms.
So in simple terms, renal insufficiency means that now your kidneys aren't working as efficiently or as its full potential. Yeah, in simple terms.
That's what it means. Not complicated. And tenofovir, which is part of the TLD and some PrEP regimen, is often mentioned in connection with kidney problems. How does it actually affect the kidneys? And we are also told that when you are either on PrEP or medication, you should drink a lot of water. I think that helps with the refining of the medication. But take us through.
Okay, so with tenofovir, right, mainly it's processed in the kidneys. That's just how the medication works.
Yeah.
And because of that, it can have some effects on what we call tubules in the kidneys. And so tubules maybe work with reabsorbing all the nutrients that's in the blood, or also excreting what is in the urine. And so it can disrupt that function and thus causing the renal dysfunction or renal insufficiency.
Just that. And how common is renal insufficiency, especially to people that are on medication? Because that's what you explained, because they're going through that. How common is it?
So it's not as common as we think.
Yeah.
Right. Mainly it happens if people are predisposed or do have pre-existing kidney issues. Right?
Yeah.
But for a normal person, just to simply have that because of medication, it's not rare, but it's not.
Yeah.
It's not totally.
Yeah.
Thing.
Yeah. And how common, or rather, are certain groups more likely to have it? And we can look at people, from young people to old people or older people, people who are on medication versus people who are not, versus people that are have a history of kidney problems. Where is it as far as that's
Okay, so as I said, right, many people who have pre-existing issues with their kidneys, also older people. As well as people who have other chronic conditions as well, like diabetes and hypertension. Because already those conditions affect the kidneys. And then now you're adding medication. And also HIV does itself also affect the kidneys, well, besides the medication. And then also, which is, I won't say unlucky, but people who take a lot of fruit. Yeah. Addiction to fruit.
And can you not have it? I mean, you can perhaps maybe you're living a healthy life, and when you look at the medical history, you don't have like previous kidney problems, and now you start on medication like TLD. How most likely are you to have renal insufficiency?
I mean, if everything is normal, you don't have pre-existing conditions, you don't really take anything that much, you're not in the older section, age-wise, it's not really that common. Yeah, as long as it's managed properly by your clinician or practitioner, then you'll be fine.
What are some of the questions that you hear when it comes to renal insufficiency and HIV medication, especially TLD, or even prevention medication like PrEP? And what are some of the, what do you hear actually out there as you go and find out about this? Please make sure that you send your comments on the comment section below, and also tag us anywhere else where you communicate, especially on X, that is at Pop and Health, with the hashtag Clinical Monday. We spoke about how common it is and the age group. How now often should kidney infections be checked if someone is being treated or is using treatment medication or prevention medication? Is it once a year, 3 months, 2 months? Yeah.
So in terms of preventing kidney insufficiency, I guess if we put it, what we do is that the first time we present or before we put you on the regimen, right, we do take bloods, right? That's your baseline.
Yeah.
So we know if something goes on along the way that we have what to refer to. And then 3 months after that. And then if everything is normal, it could be an annual thing, right? If everything is still fine, annually you take bloods. And then depending on, I guess, if you're not fine or whatever, then you could reduce that amount to like 6 months.
I got you. And then if somebody develops a renal insufficiency while on TLD or PrEP, what happens next to you? Is the medication stopped or paused or completely taken away? Are they being put on different medication? Is there other supplements or things that will supplement the medication? What is done there?
Okay, so we don't usually just stop you on well, if you do have HIV. What we do is just switch that specific pill or ingredient. That chemical, we just switch it to most likely ABC. I don't like saying the full word is ABC. I'll cover.
I got you. Harry Potter people, you get it.
But it's something like that.
A client or a patient presents with renal insufficiency or one kidney problem or some kind of a kidney problem. We can't stop the medication if they're on HIV treatment, but what happens in dealing with the insufficiency? So is the treatment added to the treatment that they're taking? The dialysis? What happens to now deal with the kidney because now it is sick, so to speak.
Okay, so it depends on how severe it is. Many people, or I guess they're in different stages, so they will require different medication depending on what the practitioner thinks is appropriate for the patient at a certain point. But if it comes to a point where your kidneys are deeply affected, then changing that turnover is most likely happening. And then we switch you to a better one which doesn't really affect the kidneys as much.
Okay. What can people do to take better care of their kidneys, especially if they're on treatment?
Okay, so one thing, hydrate. Right?
Drink water. When you say hydrate, I'm thinking liquids.
Is not water liquids?
Well, I'm thinking other liquids.
Okay, drink water.
Yes.
H2O.
Yes.
Another thing is to adhere to your medication or regimen. Whatever your practitioner says, it's okay. You must drink your medications daily. If you want to switch it because your condition, switch, adhere to that. Another thing people can do, obviously reduce the amount of NSAIDs, which is like ibuprofen, right, to better support the kidneys.
Yeah.
If your kidneys are working fine, they will better, what do you call this, react to the medication. So the medication is given to you, thus reducing your viral load, thus making you feel better, everything runs smoothly.
Water, not other things.
What?
Water. I feel we need to specify that because it's December time. People will be supplementing water with other things. And, I mean, there could be.
I mean, they'll be like, it's an ingredient.
Yes, so please let's drink water. Other than that, thank you so much for your time, Bianca. Really appreciate it. What are some of the questions that you have? Make sure that you engage with us. But yeah, man, I really appreciate you coming through for this. Actually, making time for us to speak about nerve insufficiency and HIV medication. Thank you. I appreciate your time.
Thank you. I hope I answered all your questions.
You did.
As simply as I could.
You did. And more. I will see you on the next one. Like I said, she won't be a stranger, so we'll have her again. And thank you so much for engaging with the previous content and any other content that we put out there for Clinical Mondays. Until the next Clinical Monday topic, we'll see you then. Bye.